Hi everybody, today we're going to be talking about nephritis. So nephritis is a condition, well, it's a term that's used to describe inflammation in the kidney. Now, there are two main types of nephritis, the first being glomerulonephritis and the second being interstitial nephritis. And the difference between the two has to do with the part of the kidney that is affected. Usually it results in some very similar symptoms, but we'll talk about it as we go here. Okay, so first we'll talk about glomerulonephritis. The term glomerulonephritis encompasses a range of immune-mediated disorders that cause inflammation within the glomerulus and other compartments of the kidney. So the glomerulus is this main structure inside the kidney where the filtration happens, where the blood goes through and the particles get filtered out that are supposed to be excreted through the urine. And so when you have inflammation in this glomerulus, this filter system, it ends up not working properly and things end up getting filtered out that shouldn't be, and some things that should be aren't getting filtered out, and it creates a lot of imbalance in the bloodstream. Glomerulonephritis can show up in a number of possible ways, and the first I want to mention is that sometimes you just don't have any symptoms at all. You can be totally asymptomatic with glomerulonephritis, which means it's not bad enough that you're having any symptoms yet. And so that's something that doctors have to be aware of, that sometimes this can start happening before it starts to show up in lab tests and other diagnostic criteria we talk about later on. So the next thing that can happen is it can present with nephritic syndrome. Now, nephritic syndrome starts with that inflammation of the glomeruli. There are many glomeruli within the kidney, and it's that filtration system. And when that inflammation occurs, you can end up with oliguria, which means you don't urinate very often. You have difficulty urinating. You can have cola-colored urine. You end up with hypertension because you're having difficulty getting that stuff out of the glomerulus, so your blood pressure goes high because you have too much volume of blood. There's too much blood that needs to be circulated because the stuff that you don't need is not getting filtered out. Now, the second way it can present is through what's called nephrotic syndrome. In nephrotic syndrome, you have too little of a protein in your blood that's called albumin. So this will show up in your lab tests. The other thing is you have too much fat in your bloodstream. You have hyperlipidemia, which is a fancy word for high cholesterol. And you have massive proteinuria, so you're peeing out proteins, which are an essential part of your nutrition. So when you're losing them, you shouldn't be urinating them out. You should be using proteins. So that's another indication that there's a problem. And along with nephrotic syndrome, you'll also have swelling. So you'll have those nasty cankles, and you'll feel swollen in your limbs. So that's another sign to watch out for. The third presentation is called rapidly progressive glomerulonephritis. So this happens with the same symptoms we've discussed before, only it happens very quickly, and you end up in end-stage kidney failure. And at that point, you have to either have a kidney transplant or you're on dialysis, and essentially you're going to die from the disease unless you are able to get that kidney transplant. Okay, so the second major type of nephritis is called interstitial nephritis. Interstitial nephritis is different because instead of that glomerulus, which is where a lot of the filtration happens, what is affected is the renal tubule. Now, for those who are unfamiliar with the kidney anatomy, what it is the blood gets filtered through the glomerulus and then goes through this nephron loop where things are reabsorbed. Nutrients and things that the body still wants to keep are absorbed back into bloodstream through this nephron loop. And what happens this time is that loop is affected. The things that need to be reabsorbed are not being reabsorbed. And the reason it's called interstitial nephritis is because that space between, that nephron, that functional unit of the kidney, is inflamed and swollen, and so it's not being able to do its job correctly. So the main cause of this is usually the body produces antibodies, which are, those immune proteins that attack and destroy foreign bodies, but this time the bodies produce them and they're attacking the renal tubule. So this causes problems with that reabsorption that happens in the renal tubules. And that basically encompasses nephritis, or interstitial nephritis. So interstitial nephritis can show up with a lot of those same symptoms, such as the nephritic syndrome, the nephrotic syndrome, and can lead to end-stage kidney failure, just like the glomerulonephritis. It's just a different part of that nephron that is affected. Okay, so what causes nephritis? We've talked about the main causes here, which are that autoimmune attack, which most often causes interstitial nephritis. It is also caused by toxins. So often, drug abuse creates this issue where this inflammation happens, whether that's in the glomerulus, whether that's in the interstitial space, that causes the nephron to no longer function the way it needs to filter things. Doctors who are trying to diagnose this will look for, is there a history of drug abuse, and what was the drug? Some drugs are more damaging than others. And then the last major cause is infections. Sometimes you get that infection in your kidney that affects the system. And sometimes you have a urinary tract infection. It goes on for too long, it gets bad, and ends up affecting those parts of the kidney, those functional units, the nephron. The bacteria get in there and cause all kinds of issues, and it's not able to filter correctly. Okay, so what do doctors look for when they diagnose this illness? The first thing they usually do is a urinalysis, or a UA, and that's when you pee in a cup. And anyway, they run that through a little lab test, and what it does is it tells if there's erythrocytes, which are red blood cells, so you're bleeding into your urine, which happens if that system, that nephron, is damaged, or do you have leukocytes, which are white blood cells, and what they indicate is that there's a presence of infection, and sometimes they're just because of the damage, and they're there to help repair. But the urinalysis is a simple way to detect that. Now, it's not definitive because there are a lot of reasons that you can have blood or white blood cells in your urine that don't have to do with the kidney itself or the nephron itself. If they're still not quite sure what's going on, next they'll go to the blood labs. Complete metabolic panel, complete blood count, and they'll look for the indicators of overall kidney function, which means they'll look at your blood urea nitrogen and your creatinine. And if these levels are abnormal, it means there's something wrong with the kidney itself. And still, if that's not quite definitive, they can do imaging. You can do CT, ultrasonography, and X-ray of the kidney to see if there's any kind of structural damage. But the most definitive way is a kidney biopsy, where they go in and take a little piece of your kidney, and they'll pull out those functional units, the nephrons, take a good look at them under a microscope, and they can see the damage and see what's going on. So again, like I mentioned before, both types of nephritis can lead to end-stage renal failure, which means you need a kidney transplant or dialysis. So the typical treatment for these types of nephritis, if it's autoimmune, they treat with immunosuppressants, or whatever is triggering your autoimmune response. They will treat that, and then your kidney should be able to repair itself. They will also use diuretics and antihypertensives to help with the symptoms that are caused by the nephritis, the high blood pressure, and that's treated through getting rid of some of that fluid with the diuretics and it's treated by the antihypertensives that will help, your heart beat less hard. Lifestyle modifications the patients can do include restricting sodium intake, having less protein, less potassium, less of these waste products that will build up when there's an issue with that filtration system. It's also recommended that patients should also maintain a healthy body weight and control blood sugar, as these can contribute to your symptoms of nephritis. And so can smoking. Smoking is not good and will do lots of damage to the kidney as well. Okay, so that's it for nephritis. If you have any questions, comment them down below in the comments section. Thanks for listening to my assignment. Hope you guys learned something about nephritis. I know I certainly learned a lot. See you around.